Salam and hello everyone, welcome back to The Balanced Deen. First, let me congratulate all of you who will be traveling for Hajj this season. It is a journey of a lifetime. And in this video, I want to provide several medications, supplements, and medical devices that you might want to consider taking with you on your Hajj journey. First on the list, pain medication. There are two main medications that treat pain that I want you to consider. The first is ibuprofen, which is an anti-inflammatory agent used to treat pain. It's commonly known as Motrin. And then the second is acetaminophen, analgesic, commonly known as Tylenol. In your local pharmacy or grocery store, you will see Motrin and acetaminophen, but you'll also see different generics that are available at lower costs. So consider picking up one or both of these before embarking on your Hajj journey. And the reason I'm recommending pain medication, or I'm recommending you consider pain medication, is because InshaAllah you'll arrive on your Hajj journey healthy, energized, and ready to go. But do understand the Hajj journey is a lot of work. So for example, you're flying there by plane. You will be taking hour-long train rides or bus rides between Mecca and Medina. So you will start to feel it in your muscles and your joints. You may be sitting and standing in prayer for long hours. So you will start to feel this. And then, for example, on one of the blessed nights of your Hajj, when you sleep under the stars in Muzdalifah, you'll be sleeping on the ground, perhaps in a sleeping bag or a makeshift tent, but you will be sleeping on the ground. And all of this work does catch up with you at one point or another. And one of the things you don't want to do is have to start scrambling and looking for pain medication in, the different pharmacies in the area. Now, that's an option for you, of course, but I think that you should take something with you that you're familiar with. Next on the list, cough and sore throat medication. In 2014, when I traveled for my Hajj journey, I caught a really bad dry cough that I could not shake. I did not have any cough or sore throat lozenges or medication, so I had to go to a local pharmacy outside of Masjid al-Nabawi in Medina. Now, the pharmacy and the pharmacist, they were very friendly and very kind, and they had products on hand. However, I was so confused about the products that they had. I had no idea what they were, and I was confused about the active or the main ingredients. They just weren't familiar to me. So this kind of supports, my recommendation of considering taking some medication with you so that you don't have to scramble looking for medication that you're not familiar with. So one of the products that I recommend you take with you is Cepacol. So Cepacol is a great over-the-counter sore throat lozenge and cough lozenge that should be able to help you should you happen to come up with a cough or a pesky sore throat. So look into that before you go as well. Next on the list, vitamin C and supplements. Now, you're probably already taking a multivitamin and vitamin C, which you should continue to do. Many of us don't get enough of the nutrients and vitamins we need from our food, so that's why we take supplements. One of the things you need to be aware of, and I've mentioned this before, is that when you get to your Hajj journey, you need your immune system ready to work. So taking supplements and vitamin C can be of benefit to you. One of the things you should be aware of is that there are millions of people who are going to be on their own Hajj journey doing the same exact thing you're doing in the same exact area that you're doing it in. So germs are going to be about, when you're making tawaf around the Kaaba, your mind is in prayer, but you know that there are going to be germs floating around with just the sheer volume of people. Mecca and Medina have been opening up over the last few months, but caution should still be taken to protect your health as much as possible. Barring no other health conditions, after talking to your healthcare provider or your pharmacist, consider again continuing your supplements, vitamin C, vitamin B6, and vitamin E. Also consider packing emergency, because I guarantee there will be a person in your caravan, in your group, who will start to cough, start to feel unwell, and these things have a chain reaction. Once one person gets sick, another person might get sick, and then another person might get sick. So this is not a scare tactic. I'm not trying to put the fear in you, but I just want you to be prepared as possible that these are common things that happen on the Hajj journey. So be prepared as possible and consider, vitamin C and emergency in addition to your daily supplements. Next on the list, nausea medication. I recommend you consider looking at Nausea and ginger chews, for example. There might be a time when you eat something that didn't sit well with your stomach, or from traveling. A lot of people have motion sickness. So if you're on the bus or the train or the plane and you get caught with a bout of nausea, you want to have something on hand that you can just pop in your mouth so that you don't have to, sit in agony with the nausea. Next on the list, heartburn, gas, and diarrhea medication. So let me break this up into two parts. Let's talk about the heartburn and the gas first, and then I'll talk about the diarrhea. Before going on your Hajj journey, I want you to consider taking with you Tums or Pepcid, for example. Any type of anti-gas or antacid medication, should be suitable. And the reason I am advising you to take these is because there will be a time where you're in one of the food courts and you eat something that you probably should not have eaten. And that's going to cause you to have a little bit of gas or indigestion. And you don't want to sit with these, uncomfortable situations. So you want to have these ready to go when needed. Now, for diarrhea, I want you to consider Imodium or Pepto-Bismol. So diarrhea can arise from contaminated food or water, as well as eating something that doesn't agree with your system. It could be milk, yogurt, or sugar. For example, you want to be very mindful of what you're eating when you're in Saudi for your Hajj journey. Resist the temptation to eat things don't sit well with your stomach, even if they look appealing, even if they look good. Now, Imodium and Pepto-Bismol, they are anti-diarrheal medications that have different ingredients, but they work similarly. Imodium works faster than Pepto-Bismol according to research, but they're just as effective. If you need to go to your local pharmacy to pick up Imodium or Pepto-Bismol, make sure you talk to your pharmacist about the appropriate amount to take and a schedule to take if diarrhea unfortunately happens. All medications should have clear directions on how to take them. And one of the things, you wouldn't want to do with Imodium or Pepto-Bismol is take too much and then it causes constipation. So please be mindful of the correct amount of medication to take. And this is true across the board for all medications. Next on the list, birth control. It is permissible to take birth control with you on your Hajj and Umrah journey, for example. One of the things you don't want to do is you don't want to delay or potentially not complete your Hajj pilgrimage. So before you embark on your Hajj journey, talk to your doctor, nurse practitioner, or physician's assistant about giving you a supply of birth control pills. Now, if you are not able to see or don't have access to any of those, consider walking into a women's health clinic. Go online for healthcare or telehealth, go online to see if you can get in contact with a telehealth provider, or walk into your local pharmacy clinic. Now, the major pharmacies have clinics that you can walk into, set up an appointment, and these are one of the things you should consider if you need access to birth control pills. When taking your birth control pills, it is important to take your pills at the same time every day. Let me share two stories with you. One is a group of sisters would get together every day to take their pills together. So they were holding each other accountable, and so that nobody forgot to take their pills, potentially jeopardizing their Hajj journey. Now, in the second story, a sister unfortunately thought she could stop taking her pills maybe a few days before the Hajj season ended, but her menses started maybe 24 hours after she stopped her last pill. So this is what, 24 to 48 hours. I can't remember completely, but she saw her period sooner than she thought. So this actually jeopardized her Hajj, because at that point we had not even finished, for example, the farewell tawaf before we were set to return home. So that's why it's important that when you're taking your pills, stick to the schedule and complete your pills, or complete taking the certain amount of pills you need until your Hajj has ended completely. Now, for those of you who are traveling to Hajj a few weeks in advance. So say you'll be in Medina or you'll be in Mecca, several weeks before the Hajj actually begins. You need 2 packs of pills because a typical pill pack contains 21 active pills and then 7 placebo or inactive pills. Now with the placebo pills, that's when the menses begins. That's when a woman usually sees her period. And you don't want that on your Hajj journey. So what you do is you take 21 active pills and then start the next 21 pills from the next pack. So take 2 packs with you when you talk to your provider, your nurse practitioner, your physician's assistant, or the nurse practitioner in the local pharmacy clinic, or a nurse at the women's clinic. Explain to them, I'm going on Hajj. In order for me to complete this religious pilgrimage, I need to avoid seeing my menses for a certain amount of days, and I need 2 packs just to cover me. There should be no issue getting 2 packs of pills. Birth control, be on top of it. Know your schedule, know when you need to take it, and take it so that you can just make sure you complete your Hajj with no issues. Next on the list, prescription medication. So currently you might be taking prescription medications for migraines, a heart condition, blood pressure, diabetes, or a genetic condition. Whatever medication you're taking now, take enough with you for Hajj. So if you have diabetes and you take insulin, for example, there are a few things you need to keep in mind. 1, you need enough insulin to take with you on your Hajj journey. 2, you need to store your insulin properly. Now, insulin must be kept refrigerated, so think you will need a cooler bag and some ice packs to take with you on the plane, on the bus, on the train, wherever you may be. You don't want to jeopardize the quality, safety, and efficacy of the insulin. Another thing you want to consider is what are the travel regulations, both nationally and internationally, for carrying medication. So I've left a link below for you to look into that, but these are things you're going to have to look into ahead of time so that you're not scrambling at the last minute and that you don't get caught up. One of the things when traveling for your Hajj is you really want your mind to be on the Hajj. I've said this a couple of times in this video, it's work. So you want to reap the benefits, but also make sure you have all of your ducks in a row so that you can, make sure you can focus as much as possible on your Hajj journey. Another quick note for patients with diabetes who are traveling for Hajj is to keep in mind that when you go to Saudi Arabia, you are in the desert. It is hot, so the chances of you becoming dehydrated are high. So always keep water on hand, and also please keep appropriate snacks to help you balance your glucose levels. And then last on the list, medical supplies and portable devices. This includes blood glucose monitors, needles, alcohol wipes that you would use to wipe down your finger before you stick it for your blood glucose reading, meter dose inhaler actuators, spacers, nebulizers for asthma, as well as surgical masks and gloves according to the Food and Drug Administration. Again, what you want to do is you want to do your research ahead of time and look at travel regulations within your own country and internationally about what kind of documentation you may need, what is allowed in a carry-on versus what's allowed in the check-in. Overall, just make sure you have your plan laid out if there are any medications, supplements, or medical devices that you would need to take with you on your Hajj journey. And again, with all of the medications and supplements and medical devices I mentioned in this video, please be sure to talk to your healthcare provider or your local pharmacist ahead of time before traveling on your Hajj journey so that you understand how to take the medication in terms of proper dosing or how to use your medical device. Also, be sure to watch my video on the proper safety measures needed for traveling during Hajj in the time of monkeypox. Please let me know in the comments how you are preparing for Hajj. I'm happy and excited for you. May Allah subhanahu wa ta'ala allow you a safe journey to your Hajj, and may He accept your Hajj and all of your du'as and prayers. Thank you for watching. See you in the next video.